The World Health Organization is launching a global campaign to help bring awareness to the dangers of hepatitis, and this year's theme is elimination. Here to talk more about the campaign and common hepatitis symptoms is Dr. Rohit Loomba from UC San Diego and Scott Suckow from the American Liver Foundation. Good morning to the both of you.
Good morning, Laura.
Scott, I'll start with you to talk about World Hepatitis Day, which we recently had on Saturday.
Yeah, well, thank you. Well, what we've decided to do locally is really focus on the ABCs of hepatitis, and part of initiatives happening across the country and the world to bring attention to the different types of viral hepatitis here in our community because of the hepatitis A outbreak last year and the treatments and vaccines for hepatitis B and A, and then treatments for hepatitis C. There's just a lot of information and people have questions.
A lot of people have questions. So Dr. Loomba, the ABCs, we say that because there are 3 different types of hepatitis, 2 of which have vaccines, but we need to get the information out because people are still confused about what hepatitis is and the difference between the 3. So can you help clear that up for us?
Sure, absolutely. There are many kinds of viral hepatitis. The most common are 3 that we commonly see in San Diego. Hepatitis A is caused with a fecal oral transmission, which means that if there's contaminated food supply or water supply contaminated with sewage from an infected person, then people could be exposed to it. As you know, we had a big outbreak in San Diego and approximately 600 people were infected. That led to a big campaign to vaccinate individuals, and a lot of vaccines were given in San Diego, and now the outbreak has been contained. Now, hepatitis B, as opposed to hepatitis A, is a much more infectious virus, but it's related to sort of blood-borne pathogen. So there's a transmission related to exposure to body fluids with someone who's infected with hepatitis B. Now, there's a vaccine for both hepatitis A, so it's preventable, also for hepatitis B, and it's preventable. So there's a mother-to-child transmission with hepatitis B, and you just need to vaccinate the child when they're born. Now, schools routinely will be checking, and there's a mandate for giving vaccine for hepatitis B to all individuals born in the United States. Hepatitis C, as opposed to hepatitis A and B, doesn't have a vaccine yet, but we have tremendous advances that have been made for treatment of hepatitis C, and we call it a cure now. So you can have a 90 to 95% response rate in getting rid of hepatitis C. Hepatitis C still is one of the major leading causes for liver transplantation in the United States, and we're trying to get that down so we can eliminate the need for liver transplantation.
It was a little unusual to see a hepatitis A outbreak. That's not something you typically see in a city like San Diego or in the United States even. It's typically was associated with a third world country problem. Why are we starting to see more of these outbreaks in places that are not in third world countries? Yeah,
it happens every 10 years. Some sort of a barrier breaks, and there's a situation that's created. Particular reasons for San Diego may be difficult, but maybe closer proximity to the border, also significant homeless population at the time, and lack of sanitation in certain areas. And then if it is not contained at the right time, it can lead to an outbreak. And I think a lot of things were done in San Diego County with the county's involvement, as well as American Liver Foundation and UCSD. We all came together and developed a really strong coalition to fight this back. And I think this is a wonderful example how, if the community comes together, we could contain these outbreaks and prevent them in future.
So, Scott, we're seeing a lot of people starting to learn more about the differences between hepatitis A, B, and C, and realizing that they need to check their immunization records and see whether or not they are vaccinated, because it is important to get those vaccinations against A and B. So how likely is it to achieve the goal of this campaign, which is to eradicate hepatitis by the year 2030?
Right. Well, it starts with prevention for vaccination. We, in San Diego County, vaccinated about 188,000 people with this hepatitis A outbreak. For those that received their first dose, it is time to receive the second dose. So if someone received received the first dose of their vaccine, they should go back to where they got it or their doctor and ask for the second dose. On the hepatitis C, it really is education about risk factors. There's the traditional baby boomers who we've always talked about being at risk, but there's a new cohort of folks which is really following the opioid epidemic and how they...
Speaking, of course, to sharing needles, which is another way to get hepatitis C.
So, but there's, as Dr. Loomba said, there is practically a cure. You know, so for most people, there is a cure. So it's about getting tested. So if someone feels like they have a risk factor for hepatitis C, they should talk to their doctor because the time is good. 8 weeks and on one pill a day, and then 8 to 12 weeks based on the type, and then could be cured.
Okay, well, we really hope that that goal is achieved, and we thank you both for raising awareness.
Thank you.
Thanks for being here this morning.